This is Selma Schimmel for the group room at the San Antonio Breast Cancer Symposium, joined now by Dr. Martine Piccart, Head of Medicine at the Jules Bordet Cancer Center in Brussels, Belgium, also the President of ESMO. Welcome, Dr. Piccart, and thank you for making time. What are some of the things that are pressing on your mind as the President of ESMO, the European Society for Medical Oncology, for the patient perspective, and that you would like patients to know about, because you must every day wrestle with all kinds of thoughts, and I know that you are a great visionary person and that you have tremendous goals. So while you are in this position at ESMO, where's your focus now, and how can the advocates help you propel that forward?
Well, that's a very important question. I think patients probably know that we are entering a fabulous era where we are going to be able to look at the genetic material of their tumor, at their genetic material, in ways we have been unable to do until now. So sometimes I tell patients, it's like you look at the sky at night with your eyes and you see 20 stars. And imagine that now we take a telescope and we are going to see millions. This is exactly what's happening with the way we can look at tumors. But then they should know that there are all sorts of barriers to conduct very good translational research in the context of these trials. So the barriers can be, first, that there is not enough funding to collect the tissue, or the company is not very interested in doing that. Fortunately, it doesn't happen very often, but that can happen. Then in Europe, we sometimes have problems for the tissues to cross borders. Certain countries are very, very rigid. China, for example, which is now participating in our large breast international group trials, it's impossible to get the samples going outside of China. So it complicates the work. And on top of that, the EU is preparing a directive on data protection. So data protection, you immediately understand that it's probably important, given all the communication tools and the fact that privacy is under threat. But can you imagine if the law is not well written? This could perhaps block research at a time where it would be a disaster to block research. So if we introduce laws that are too restrictive, and if we can no longer access the clinical outcome, for example, of a patient to relate that to what we find in the tumor, then we will not make progress. And that would be so frustrating, because it's now that we can really start doing a fantastic job. So that's a message that I think is important. Another one is that I still find people are working in isolation. I still find that there is no sharing of this data, and that given the complexity, the huge complexity of these cancers, it's only if we share all this data soon and make them accessible to brilliant people that we are going to help our patients.
Are there efforts underway that you feel will ultimately resolve this tissue sharing dilemma?
I have seen a very good initiative in the US where they try indeed to bring people together, tumor samples together, so that they get big numbers. That's an initiative that deals mostly with response to our 2 days drugs and all drugs. So that it's a little bit easier because you don't enter into intellectual property right issues, problems that you have with new agents that are not yet on the market. But what I would like to see personally is a different spirit in research, also for the drugs that are not on the market but that are incredibly interesting. These drugs that are really targeting important components of the cancer cell, and it looks like until they are on the market, and that takes 10 years, everything is very protected.
In reality, the patients themselves would be delighted to share their tissue. The
Of
patients
course.
aren't the issue. However, the regulatory restrictions are probably the greatest cause for the impediments that are
That and
keeping
then
the
the fact, of
exchange
course, that companies are not so
eager to share.
prepared to share. Yes.
Do you think if there was a public outcry and a real concerted effort on behalf of the advocate community, do you think we could be the ones to really force the greatest change?
I think that this would be the solution. I think patients are in much better position to introduce these changes, and I would love to see such an initiative.
Thank you.
Thank you very much.
Dr. Martine Piccart, Head of Medicine at the Jules Bordet Cancer Center in Brussels, Belgium, and President of ESMO.